So I want to welcome you to the In-Home Supportive Services webinar, which is supported by the County of Santa Clara, as well as a grant from Kaiser Permanente. Now, I think it's important to begin with a disclaimer. Now, at Parents Helping Parents, we do these presentations in order to educate families like yours who are looking to learn more about services and public benefits like in-home supportive services and how to navigate the application process. At the same time, we're not able to provide any legal advice on your particular situation, should you need any. So we want to make that clear. And, on the same vein, while we do our best to keep our presentations up to date, and it is as of the recording of this webinar on February 27th, 2025, I just want to say that public benefits programs are continually changing. So if you're watching a recorded version of this presentation, some of the information may have changed, and you can always call us to verify if that's the case. All right, well, without further ado, let's go ahead and get started. All right, so I just wanted to spend a moment on what we're going to be covering today. So today's agenda will be primarily focused on how to apply for what's known as in-home supportive services, known as IHSS. And I'm going to walk through how to prepare for the IHSS assessment, how to apply, and provide a basic understanding of what IHSS covers and how the process works. I'll also share the eligibility requirements and walk you through the application process. And that's so you'll feel more confident when you're applying, as well as have a better understanding of what it takes to have a successful outcome for your application. So with that in mind, here's what we're going to cover in the next 45 minutes. What in-home supportive services are, the types of things that they actually pay for and what they don't pay for, and who the program is meant to serve. We'll also go over an explanation of the eligibility requirements for someone who's seeking IHSS for their child or family member. And this will also include the role of Medi-Cal in IHSS eligibility. And just as a reminder, Medi-Cal is the California version of Medicaid. So for those of you who have children with developmental or intellectual disabilities, coupled with unpredictable and unsafe behaviors, we're also going to talk about what protective supervision is and who is eligible. We'll also go over how to apply and prepare for the assessment that happens after your application has been received, and what an in-home assessment with an IHSS representative looks like once that's scheduled. And then we're going to walk through the necessary forms that you have to complete. And I know that everybody just loves paperwork. Obviously, I'm joking. But this, I'll talk about the specific forms that you need and who needs to sign them or fill them out. Well, actually, you need to fill them out, but also your doctor or your child's doctor needs to fill out at least one, if not two. And we'll get into that in a few minutes. And then I wanted to talk a little bit about the definition of in-home supportive services. So it basically provides in-home help to those who are disabled, blind, or over the age of 65. And it provides, one-on-one in-home care to people who, have some sort of disability and enables them to stay at home, meaning that they don't have to go into some sort of nursing care placement outside of the home. So in other words, instead of having to move away from their home, because they either, in a child situation, they have some sort of unsafe behavior, they're like a board and care home placement, they're able to stay in their family home. And that is really key because there are times when a child has such unpredictable and unsafe behaviors that they require 24/7 supervision. So IHSS can provide that one-on-one supervision and care to help keep a family together and help keep that child there because it pays for that one-on-one care that the family desperately needs. So it's a really important public benefit, and that's why we're talking about this. So the services that can be covered range from everything with regards to household chore assistance to personal care, like helping someone get dressed, helping someone shower, to paramedical services, to protective supervision, which we'll talk about more in depth in a little bit. So IHSS is a statewide program within the California Department of Social Services. It's funded by state, county, and federal dollars. It is a California-specific program. And there may be programs outside of California that are similar, but we're talking specifically about California's IHSS program. Okay, so there are a number of services available through the IHSS program in terms of what's covered. So I'm going to go over these in a little bit of detail. So the first of which is domestic services. So these are generally not available for children under the age of 18. I just wanted to say that up front. And these services are generally things like cleaning, sweeping, taking out the trash. Now, even though house cleaning is generally not a service covered by IHSS for a minor, I do want to say that certain cleaning tasks, such as keeping your child's medical devices clean and in good working order, may be covered under domestic services. So make sure to document any cleaning or maintenance tasks you do on a regular basis for your child's medical equipment that they use. And talk to the social worker that you meet with once the personal assessment appointment takes place. So related services. These are things like meal preparation, cleanup for meals, laundry, putting items away, and food shopping. Now, some examples where IHSS may be needed more is when your child has toileting accidents, and there's more laundry that needs to be done than a typical child their age would need. Or with eating, if they're 8 years old and they don't have the motor control to hold a fork and bring it to their mouth, make sure to write that down in your application to IHSS. Personal care services. This is another big one, depending on the disability that your child has. So these are things like help with feeding, getting dressed, grooming, toileting, and bowel and bladder care, as well as getting in and out of bed. If you have a teenager, for example, who needs help with shaving, that counts as well. And then accompaniment to doctors or other services like their day program. And then paramedical services. These include things like injections or range of motion exercises, wound care, or tube feeding and suctioning, and help with taking care of any prosthesis like artificial limbs or hearing aids or visual devices. And then the last category of protective supervision. This is a big category for families who have a child with an intellectual disability who wanders or bolts away from them. It's defined as one that focuses on monitoring or the need to monitor a cognitively or mentally impaired person to safeguard them from injury, hazards, and accidents. Now, if you have a child who is mobile, but doesn't have the cognitive ability to understand how to stay safe relative to the kids of the same age as them, this is an area to consider as an IHSS service. And we'll go into detail more about this in a few minutes. Okay, so one of the main ways that IHSS staff look at how many hours of IHSS to pay towards your child's or person's need is by categories of activities of daily living. So it's a term that healthcare professionals use to refer to people's daily self-care activities. So when your assessment is done, the county social worker will come into your home and meet with you and observe your child and determine, what you do for your child in each of these categories. Now, you know better than anyone what you do for your child every day. So make sure that you write down everything that you do for your child and how long it takes you. Now, you can do this on a Google Doc or whatever way works best for you. Now, some tasks may take a lot longer because your child needs far more help. For example, if you have a 14-year-old daughter with an intellectual disability and autism who gets her menstrual period, you may be spending 5 days of her menstrual cycle each month working through that with her and helping her. Whereas a typical 14-year-old girl would be able to take care of her menstrual period by herself. The goal with the social worker is to figure out what help your child needs and in which of the activities of daily living categories beyond what a functioning child of the same age is able to do on their own. Then the social worker will assign hours or minutes to each of those activities of daily living in which your child has needs. And out of that, they'll come up with a total number of hours that your child will receive each month for in-home support services. That time, that amount of time that will be authorized in your child's final IHSS hours is based on the time it takes your child to do their activities of daily living. One important thing to note, all of these activities of daily living calculations does not include the protective supervision, since it's not a typical activity of daily living. Protective supervision hours are in a separate category of its own. Okay, so let's talk about who can be an IHSS provider. So it can be parent. That's right, parents can get paid to be IHSS providers. It can be friends of yours. It can be a neighbor or a relative. And if you don't know anybody that would be appropriate for taking care of your child to be an IHSS provider, you can find and hire a contracted provider available through one of the IHSS public authority providers. So the organization that is the overarching umbrella, basically the overarching organization that takes care of managing the IHSS program is called the Public Authority. So they have a database that you can find workers who have already been screened and fingerprinted and background checked, who are available and trained to actually find somebody to be an IHSS provider or caregiver. And that's listed here at the bottom on that website. Excuse me. So you as the parent, you're basically responsible for hiring and supervising and firing the person you select as your child's IHSS caregiver. So once you've identified who that provider caregiver will be, if they're not already a current IHSS provider, you'll need to have them go through the screening and fill out an application and attend a basic training. And then you can look at the link on this slide to see what the steps are in terms of becoming a provider. Okay, so I'm sure you're all dying to know, like, what are the eligibility requirements for, in order to become eligible for IHSS? So Your child must be physically located in the United States, and they must be a California resident. They must live in their own home and not in an institutional setting or other congregate setting, congregate meaning some sort of group setting, like a group home or intermediate care facility. They can't live in a nursing home, or any other place except the family home. And when I say home, that means like any sort of dwelling, like an apartment, a mobile home, or a house. They need to be with their family, essentially. And that can be, any sort of family. The overall requirements for IHSS state that in order to be eligible for IHSS, the person must be either over 65 years old, blind, or disabled. Now, while there's no technically minimum age to receive IHSS, generally, they do not offer IHSS to infants or young toddlers under the age of 3. Or I should say any hours for IHSS for infants or toddlers under the age of 3 are limited to paramedical services or accompaniment to like disability related appointments or therapies. And the reason for this is generally because infants and young toddlers require complete 100% care from their parents, regardless of their ability or disability. Those who are applying for IHSS must also be enrolled in a Medi-Cal program. And depending upon the enrollee's countable income, they may also need to pay for a portion of the Medi-Cal insurance services. And I know you probably have questions about what I just said. So there are resources here and also at the end of the presentation where you can get more information. And you can also call us. And I'll have all that information at the end. So for those who apply and are subsequently determined to fall into the low income bracket, there won't be any share of cost for Medi-Cal. So basically, if your child's a regional center client, and if your child has, certain disabilities that automatically qualify them for regional center services, talk with your regional center's caseworker. They should already have Medi-Cal. And if they are a Medi-Cal, if they are already a regional center client, they should have Medi-Cal. And if they're a regional center client and don't have Medi-Cal, then please reach out to your caseworker at your regional center about IHSS and their eligibility needs for Medi-Cal, because you have to have Medi-Cal if you want IHSS or need IHSS. That was clear as mud, I'm sure. Okay, now for protective supervision. So this is really critical, and this really was born out of the need to help those families who have children with very unpredictable behavior that puts their lives in danger and puts them at risk of being placed out of their homes. So for those of you that have these children who are have behavior that's very unpredictable, they're doing things that are really dangerous, this section is for you. So protective supervision is an IHSS service for these people, both for children and for adults who need to be supervised 24 hours a day to protect them from hazard and injury and accidents. So I know I've said this before, but I'm going to just reiterate it. The whole idea behind protective supervision is to provide that support for the child to keep them safe and for their family, so the child can stay at home and not need to be placed in an intermediate care facility. So to be eligible for protective supervision, a child must be mobile and therefore be capable of getting themselves physically into dangerous situations. Other factors that are looked at in determining the need for protective supervision include the lack of good judgment for decision-making, and an impaired or poor memory. So I've listed some examples here that people usually ask about in terms of, well, what qualifies as behaviors that would lead to a need for protective supervision. And, my sons have engaged in all of these things. And I'm sure those of you that need protective supervision can relate because you've probably also experienced these. So one of the big ones is wandering or elopement, where, a child just takes off running because they see something that they like, and, they're running across a freeway or a busy street, or they, jump into a pond, they don't realize that they can drown. So really dangerous things. So in terms of protective supervision, these are really the key determinants in terms of what distinguishes the need for protective supervision from an IHSS evaluation standpoint from routine childcare. So protective supervision is needed when a child needs monitoring 24 hours a day to stay safe. As well as when a child, and they don't have to have all of these things happening in the same child in order to get protective supervision, but these are examples of behaviors or characteristics that occur within a child in order to be eligible for it. So, when a child has self-injurious behavior on a regular basis, so hitting themselves, biting themselves, banging their heads. One important distinction I want to make is self-injurious behavior is not considered self-injury when it includes things like kicking or throwing things, because that's not considered self-injurious behavior. We're really talking about they're banging their head on the ground, they're hitting themselves in the face. Other things such as, does a child not react or listen to parental directions or turn around when you call their name? And this is really important, do you have to physically intervene to stop their dangerous behavior or redirect it? And then does the testing, any sort of evaluations been done in terms of a developmental evaluation that they've had for school or early intervention services or pediatrician evaluations that show that their behavioral age is significantly lower than their chronological age? So for example, if your child is, chronologically 9 years old, but their developmental assessment shows that their functional ability is at the level of an 18-month-old, well, that's a clear indicator that your child is a strong candidate for getting protective supervision. So you can start pursuing protective supervision at the age of 3 if your child has a mental impairment and engages in self-injurious behaviors. And I would say, you can start gathering and drafting the supporting documents, as soon as you start seeing these behaviors. And some examples of really important documents are your regional center documents, any IEP documents that you may have, police reports that show your child wandered away, and your own tracking of incidents that have occurred within or outside the home. Okay, so here's some examples of where protective supervision is not offered because it doesn't qualify for, it doesn't meet the need for IHSS. So it's not routine childcare. In order to qualify, the social worker really needs to determine that the child needs closer supervision than other children of the same age because of their impairment. So just to give some further examples around this, in order to get IHSS, the additional supervision required for a child that qualifies for IHSS must be significantly more than your routine childcare. So to to consider this, if you have an example of a 6-year-old, a typical 6-year-old can be left alone in a living room for 3 minutes while mom uses the bathroom. A child who needs protective supervision due to autism and elopement behaviors generally cannot be left alone in the living room while mom goes to the bathroom for 3 minutes. This is a child who needs protective supervision because in those 3 minutes, that child with autism and intellectual disabilities could leave the house, walk down the driveway, and drown in the neighboring waterway, or walk into traffic with tragic consequences. So something to know, and this is a common misconception that I want to clear up. Your child's official diagnosis does not automatically qualify them for protective supervision. It's their level of functioning that will qualify them or not qualify them for IHSS. So when the social worker looks at your application for IHSS, it's your child's behaviors and, their record of incidents or unsafe behaviors and what happened, whether they have had accidents or trips to the ER, and, what's happened as a result. So documenting is key. Okay, so these are just a few situations where protective supervision is not applicable. So, you can't get IHSS to do social visits with family or friends, or when you need supervision for your child due to a purely medical condition. So this is something, like let's say your child has asthma and, they need monitoring to make sure they don't have asthma attacks. That's not what the protective supervision program is for. Another example is if they, are having antisocial, if they have a mood disorder and they have, a proclivity to engage in antisocial behaviors or aggression, and they're getting into a lot of fights with students at school or their peers. This is not a situation in which you would be able to be eligible for IHSS. And I know sadly we have an epidemic of suicidal behaviors or, students who are, really struggling with mental health and cutting and other, really tragic situations around suicide. There are mental health services available for them. IHSS is not a service that addresses that, or it was designed for that. So call PHP. We have support groups to help families that are dealing with that. We also can direct you in terms of providing some resources for teen mental health and other behavioral health situations for that. Okay, so let's talk about the application and getting ready to apply, because this is a big part of it now that you're getting ready. So we've talked about documenting what you do for your child, and this is critical to getting hours for IHSS approved. The number one thing you can do to improve your chance of getting IHSS approved is to create a list of everything you do for your child and how long each task takes. You can do it with a paper and pen. You can use a notes app on your phone or Google Sheets, whatever's easiest for you. Spend a couple weeks tracking the time it takes for you to take care of your child on a daily basis. And I know this is like one more thing you have to do. And believe me, I know because I've done it myself and I have 2 kids with special needs, and it's one more thing you have to do, but it's worth it if you need IHSS, and it's so worth it in the end. And I'll just say, as parents of children with special needs, we do a lot that seems very normal for us, but it's beyond what others, have to do for their children of the same age that don't have extraordinary or exceptional needs. So people need to know what you're doing, and get the help you need. Ask for the help and show them what you need. It's worth it. So in terms of protective supervision, you'll want to ask and list what hazards have posed risks for your child's safety. You can list the actual events that have happened, or things that potentially would have happened if you were not there to intervene and prevent those things from happening. So things like, your child loves fire and keeps reaching for the burners on the stove every time they're turned on. Eating things off the ground that are not edible, like rocks, and doing that. Climbing up on top of tall cabinets constantly. Running out into the street and lying down in an intersection. Whatever it is, write it down. Okay, so how do you apply? To get started, you'll need to gather all of your info for you, your child, and your immediate family members. Your contact information, social security numbers, and your child's Medi-Cal number. And then once you have all your personal information together, you'll need to download and print the application for in-home supportive services, the SOC 295L form. And you can get that at this website. And just download it, print it out, fill it out. Oops, sorry about that. You'll also need to download and print the healthcare certification form, the SOC 873, which explains to your doctor what IHSS is and gives you authorization to release healthcare record information to IHSS. That way your doctor can testify to your child's disability and let the IHSS staff know that your child does have a disability, the extent of that disability, and will further justify your need for that IHSS. And then if you're applying for in-home supportive services, you'll need to download one more form, the Assessment of Need for Protective Supervision for In-Home Supportive Services, SOC 821, at the very bottom here. Okay, so this is what one of the forms looks like, the 821 for protective supervision. I know you can't really see it very well. I just wanted to give you a sense of what it looks like. Bring this form with you if at all possible. I know a lot of doctor offices just have you, put things through their healthcare portals online. If you already have an appointment coming up, I always like to bring it with me and just smile and say, can you please fill this out? And sign it. That way you get it right there and you don't have to wait for a long time. And the doctor will just check off whether there's a deficit or not, and if it's severe or moderate, and then add a little note about, why they think that. If your child doesn't really know the doctor very well, or I should say if the doctor doesn't know the child well, attach your notes about how all the hazards that they've gotten into, and that way they'll have a document, about what's happened with your child and their situation. If you're applying for a child that has a medical condition, like a motor condition like cerebral palsy or some sort of neurodevelopmental disability where they've seen the child on a regular basis, it may be easier for them, but either way, it's a best practice to bring documentation and attach it to that form so that it makes it easier for the doctor to fill it out. And that way it'll be more complete. And again, you'll get a better form filled out with more complete information. And that will bode well. It'll bode better for you to have that when it's more complete, more accurate, and therefore gives the IHSS staff more information to go off of. Okay, you can send in via mail. There's also a Dropbox at the IHSS office on West Julian Street. You can email it at that email address. Whatever you do, please make a copy of everything that you have. Whether you just scan it with your phone and just take a bunch of, like a picture of every page, or you can make a copy for yourself. Make sure you have a copy. You don't ever want to get in a situation where you don't have a copy. Okay, so let's talk about the assessments. So basically within 30 days after your request is, received by them, a social worker will come to your house and do a needs assessment. And they will talk to you and get a deeper understanding of what's happening with your child and the degree of disability that they have. And then that, they'll see how that translates to the extra care that you're going to need in each of those activities of daily living that we talked about at the very beginning. And the social worker is also going to want to either talk with your child if they're able to talk, or observe your child if they are nonverbal. Now, the goal here is to learn more about what types of services are needed for your child to stay safely in the home. And then that will help them figure out the number of hours that will be paid for by IHSS. During that home visit, make sure that you ask for protective supervision if you need it. It might not be offered to you, even if it's obvious to you that your child needs it. One suggestion that a mom had a long time ago, and I think is really important, even to our children that have cognitive disabilities that are severe, all of our children understand a lot more than we give them credit for. So when we're talking about our children's challenges with other people, it's a good idea to do it when they're not nearby to overhear what we're saying about them, as this can be really hurtful to their self-worth. So if you are able to have someone else, whether it's, your family member or friend or a caregiver, take your child out of the area, like take them to a different room or somewhere else when the IHSS social worker is there, so that they don't overhear your conversation with the social worker. We highly recommend it. Okay, so this is the functional index scale, and this is a scale that will be used to measure need. It evaluates your child's individual, like physical, cognitive, and emotional ability to get all of those activities of daily living activities done that we talked about. So are they able to do each of them independently? Do they need a little verbal prompt? Do they need some help, a lot of help, or are they just not able to do it? So they have an entire rating scale that, for the purpose of today's webinar, I'm not going to go into. It's very detailed, but you can look up on the website that I'll have at the very end of today's webinar and drill down on all you like to see the whole calculation on that. But this is part of that whole formula they use to determine how much they give in terms of hours. Okay. Disability Rights California is an amazing organization. If you don't already know about them, they do a lot of advocacy in the realm of disability. And they have an article that was released a few months ago about how do you understand the hours that are calculated for IHSS. So if you have questions about that, they have a great graph that shows like, oh, how do you actually determine the hours? And they use examples of, cases with respect to a person with an intellectual disability, with a physical disability, and they show it all out there. And then they talk about advocating for the need for IHSS and why that's important. And how to advocate for yourself if you feel like you are not getting what you need. So I highly recommend this article. But in any case, that is there for your viewing pleasure. This is basically just a reiteration of what I talked about earlier, where, some activities of daily living might need more time. So it's not just, for example, if you need more time, if there are bathroom accidents. And, cleanup is just part of the bowel and bladder care activity of daily living. And it's not just time for the actual cleaning, but it takes time to change the sheets and to do the laundry and to change your child's clothes. Okay, so protective supervision, it's not offered automatically. You have to ask for it. And the bulk of IHSS hours is usually in the area of protective supervision, because those of you that are hypervigilant about children that wander and take off, that's what you spend your days doing. So the maximum number of hours will vary between 195 to 283 hours a month, depending upon the severity of the disability. So once you make the request, you must provide evidence of the need and have medical documentation from your child's doctor. So you really do need to have that healthcare certification, the SO 3873 form filled out from the doctor that we talked about a few minutes ago. Okay, and this is just an example of like a injury or hazard log that you can refer to. If you're wondering, well, how do I document this stuff? Here's an example of one, where you just, what's the situation, like in, a short sentence, what's the risk? And then what type of support does my child need in order to keep them safe? Okay, so there's something called the 24-hour plan. So if you're applying for protective supervision, you want to download and print the SOC 825. Now, because a child or, an adult who is also cognitively impaired requires 24-hour supervision if they need that, this is where you need to write the 24-hour day coverage plan, because they're going to say, okay, so, IHSS doesn't fund 24/7 coverage. You'll need to explain like how that coverage will be provided. So one thing they require is that even though they provide some of the coverage, you'll need to show that you have some other resources available to provide that continual supervision. And other resources include things like school for children, under the age of 18 or 22, or a day program for those who are over 22 and, are a part of a day program. And then IHSS, once that becomes, available to you or to your child. And then any other voluntary resources for those of us who are lucky enough to have that. And then independent providers. So for those who are curious about the rates and how that works, in Santa Clara County, and there are rates available at this website at the very bottom that show what the rates and all the information that I'm describing here. There are, in Santa Clara County, there are about 17,000 IHSS providers total. Now, there are rates that you can see by county. If you go to IHSSadvocate.com, you can see IHSS rates by county. So our rate here in Santa Clara County is $20.04 per hour as of 2025. Independent providers are eligible for health, dental, and vision plan at $25 a month. And you must be paid, I think so you must be paid by Santa Clara in-home supportive services for at least 35 hours per month. And then you can enroll in benefits. You can also join the local union as well. And so if you want more information, you can go to that website at the very bottom for the public authority in Santa Clara County. Okay, so for those of you that have respite hours, and I know nobody uses their respite to go get a massage, but hey, so sometimes people wonder if respite hours will be cut if they get IHSS, and the answer is absolutely not. They should never be affected. They're two distinct services. Respite is something completely separate from IHSS. So if you ever get in a scenario where your caseworker says, well, now that you're getting IHSS, you're not eligible for respite anymore, you can call the Office of Clients' Rights at the bottom and get their help with that, because that's not the case. You will never, you should never have your respite hours reduced or cut because of IHSS. Okay, so I know you're probably wondering, how do you know when you get approval or denial of IHSS services? So once you have the assessment, Santa Clara County or whatever county you're in should do this or should let you know via mail that you're going to get a notice of action. So they'll send you this letter that says notice of action, NOA, and that will tell you whether you've been approved, and if so, how many hours have been authorized per month for your child, when those services can start, and it'll have the effective date on there. And then it will, have like the total hours and minutes, and it'll tell you, the rules that it used to make that decision. So you get X hours on protective supervision, Y number of hours on personal care, and then, you'll have how much time is allotted for each of these services. Now, if you were denied, it will contain that information about what you can do for appealing. So if you were denied, or if your hours were reduced, or if you had IHSS and then they decided to end your IHSS, you can request a hearing. So let's start with, you just applied for the first time and they denied your initial application, okay? You have 90 days from that notice of action that you got to appeal that decision, okay? So it's really important that you appeal that decision within the 90 days of getting that first notice, because otherwise you lose your right to appeal. And there'll be information in that letter that will tell you how to appeal. For existing clients, your request has to be made before the reduction goes into effect. So that information will be on the first page of your notice of action, the date of when your reduction of hours takes effect. You can have an appeal either over the phone, or you can do it in writing or online. And the website at the bottom, the California Department of Social Services, .ca.gov hearing requests, that's where you can go to file your appeal. Okay, you guys did it. You reached the end. So, some things to remember, because I know this was a lot of information in a very long webinar. No one knows your child better than you do. So, trust your instincts and don't be afraid to advocate for what you need to help your child be safe and healthy and to get what they need. Because what they need is what you need ultimately, because, as a family unit, you're only as strong as the person who is struggling the most. So when they get help, that means you get help, everybody gets help. Documenting everything is really important, and keeping copies of everything is really important. So if your doctor has has something they give to you, make a copy of it. Because inevitably at some point in your career as, your child's very own personal case manager of everything special needs, someone's gonna lose a bunch of paperwork that you filled out. And unless you make a copy, you're gonna be so upset. So make copies of everything. And lastly, PHP's here. We have specialists who literally specialize in certain areas, whether it's early start, for early childhood issues and questions and areas, or education when it comes to IEPs and everything related to school, or what happens when your child is no longer in high school. What happens next in adulthood? We have an entire program dedicated to that. So please call us or send us an email. We're here to help. And I just want to say thank you for listening. And we're so glad that you were here with us today. I wish you all the very best.